evening. Welcome, Facebook family. This is a live first episode of the National Coalition of 100 Black Women's West Palm Beach chapter Community Health Education Talk Zoom. Our intent is to educate the community about health concerns impacting women and girls in our community. We would like to take the opportunity with this program to highlight health issues in our community, as well as how to access resources and also access care related to these health conditions. My name is Charlotte Leonard. I am the co-chair of the Community Health Education Talk Zoom, and I am the co-chair for the Health Committee for the National Coalition of 100 Black Women. At this time, I'd like to turn it over to my co-host and my co-chair. She will introduce herself and our guest speakers for this evening. Thank you for joining us.
Good evening, Facebook family and friends. My name is Sabrina Blue Cooper, and I am your co-host and co-chairman for the National Coalition of 100 Black Women Health Committee. Tonight, I have the privilege to introduce to you two dynamic speakers. Our first speaker is Sheree Wolliston. Sheree is the Vice President of Health Strategies for the American Heart Association, serving Palm Beach, Martin, and St. Lucie counties. She serves her organization as the health strategist, subject matter expert for her region, and collaborates with community partners to support the American Heart Association to be a relentless force for a world of longer and healthy lives. Sheree is constantly developing and driving corporate engagement strategies, working with volunteer and community partners to create a culture of health, building coalitions, collaborating with local health systems and providers to improve patient outcomes. Sheree graduated from Florida Atlantic University with a degree in public communication, minoring in sociology with a certificate in ethics studies. She began her public service career years ago when she served as a case manager and a certified housing counselor with the West Palm Beach Housing Authority. She's tireless, she's effective. She can stand the heat even when the others get out of the metaphoric kitchen. She's forever putting her energy behind community building efforts and coalition building organizations that makes the world a better place. Simply put, she's an unstoppable force for change. Let me introduce to you again, Sheree Wolliston. Thank you for joining us, Sheree. At this time, I would like to introduce our second speaker. Our second speaker is Dr. Wilhelmina Lewis. She is the President and Chief Executive Officer for the Florida Community Health Centers. Dr. Wilhelmina Lewis is an innovative, passionate, and relentless leader of the American Heart Association Equity Council. As chair, she has led the council to developing strategies around how we drive equitable health outcomes in our market around a metabolic syndrome. Dr. Lewis is a board-certified family medicine physician with fellowship training in geriatrics. She received her undergraduate degree from Princeton University and attended medical school at the University of Cincinnati College of Medicine. Dr. Lewis is a key voice and influential partner in our clinical systems work and our lead champion for health equity. Welcome, Dr. Lewis. And thank you both for joining us this afternoon as we begin our health spot with National Coalition of 100 Black Women. So I'm going to dive right into this here, and we're going to start asking you a couple questions. My first question, I would like both of you all to answer for us. And the question is, tell us about you and what brought you to American Heart Association. Dr. Lewis, I'll start with you.
Thank you. And thank you so much for the honor of being able to be with you and your audience this evening. It's absolutely a pleasure. As you already mentioned, I am a board certified family medicine physician, but I'm also the granddaughter of a sharecropper and the daughter of a migrant worker. And because of my background, I grew up in a very small town called Clewiston, Florida, as they would say, on the muck. Grew up without health insurance and knew firsthand what it meant to not really have access to high quality and cost effective healthcare. So as a part of that experience, it became my life's mission to make sure that other people had access to care. As a result of that, I wound up at Florida Community Health Centers, where I now have the honor of serving as the CEO. And through that work, I was blessed to meet Sheree, and we started to work together on some of the initiatives of the American Heart Association as we tried to help underserved patients in the 6-county area surrounding Lake Okeechobee.
Thank you, Sheree. Tell us what brought you to American Heart Association.
Well, hello everyone. And I just want to thank you so much, Dr. Lewis, for being here and for all that you do for the organization and for being such an amazing individual outside of everything that you do for the Heart Association. I absolutely love you. I came to the organization about 3 years ago, and honestly, what brought me to the organization was my husband. He actually saw the post or the position that I'm in, well, that I was in when I came to the organization, and I just remember him texting me and saying, "This is so you." Actually, he said, "This is so you, babe," and that was the the text that my husband sent me. And when I interviewed for the position and I got the position, I love the organization, I love the mission, I love the work that we do. But it wasn't until I lost my husband to heart disease in 2019 when the mission really became a part of who I am and my life's work. And so the person who brought me to this organization was my husband, and the person that keeps me going in this organization and the work that I do is him as well.
Thank you so much. So Sheree, the next question is for you as well. What are some resources available for the African American community to connect with American Heart Association?
I'm so glad that you asked that. You know, when it comes to the American Heart Association, there's so much that we do, both locally and nationally, in clinical systems and in the community. So for the African American community, especially, one of the things that we're working on right now, and that has been a part of the work that we do over the years, is achieving health equity. And we're trying to, you know, over the years, our organization, we're about 100 years old. We're going to be 100 years old in about 2 more years. And from the beginning, we started with a group of cardiologists who wanted to make sure that having heart disease was not a death sentence, right? So we started with education, awareness. The work gradually went into working with community health centers and physicians' offices and making sure that we were educating people on some of the behavioral changes that they could do to improve their health outcomes. We focused on clinical care and making sure that, you know, doctors and physicians were educated on best practices. We've always been funding research that has been a part of some of the medical advances that have impacted all people. But, you know, when it came to the work that we're doing, we saw that health, we were improving health outcomes were improving, but they weren't improving at the same rates for all people. And we saw that when it came to health outcomes for African American communities, and when it came to health outcomes for Hispanic communities, Native Americans, and just persons of color in general, there weren't as many advances in health, in the health equity and reaching those optimal outcomes as we wanted to see. So we started looking at some of the social factors, some of the things like structural racism, some of the things that people have to, the conditions that people are living in. And we realized that, you know, a lot of the things that impact our health, a lot of them are circumstances that are outside of the health center and health system. So one of the things that we do locally and in our communities is partnering with local community organizations, grassroots organizations, small and large, to help to implement policy, system, and environmental changes that are going to improve overall health. So how do people get, African Americans get, involved in the Heart Association? One, volunteers are our life source, right? That's the way that we get the message out. That's the way that we raise funds. That's the way that we're able to fund the research that we do. So, if anybody ever wanted to get in contact with me, they could do so, and we can work on something together. But also you can go to heart.org. On heart.org, there are plenty of resources around different health topics, from heart disease, high blood pressure, from issues around diabetes and the tie between diabetes and heart disease. There's information there about high cholesterol and managing that condition. And there are tons of other conditions, metabolic syndrome, all of those different things that you can learn about and educate yourself about. We also have a platform called Empowered to Serve, and that is specifically for multicultural communities. And it's really about giving communities and community members and the community leaders the agency and capacity building to affect change in their own communities. So some of the things that you can learn about through that platform are advocacy. You can learn about building better communities, healthy eating. You can learn about things such as, tobacco and vaping, and how the tobacco industry is really targeting communities of color and youth, all of these different things. So that's empoweredtoserve.org. And then another thing I would mention is we have a evidence-based curriculum for communities to use. It's called Healthy for Life 20 by 20. That's also available on our website. And it is a suite of about 36 lessons that, if faith leaders wanted to take it and use it in their community to educate their community members about health and well-being and eating healthy and all of those different things, they could do that. It's available for anyone to use. Organizations, if they wanted to facilitate it, it's available to use as well. And this is hot off the presses, but we're actually really trying to find a way to really impact faith leaders and congregations. And so we are actually providing funding for churches that want to start or expand their health ministry. If you go to our website, our local office's website, you'll be able to see that information and fill out that proposal. But we're looking for church leaders who also want to help improve the health of their congregations too. So there are plenty of ways. I'm going to put my email in the chat if you want more information, and I can also put some links to all of the things that I just talked about. But and of course the Heart Walk, which we're going to talk about later. But there are plenty of ways for you to get in contact with the Heart Association and access the resources that we provide.
Thank you so much. Dr. Lewis, why is American Heart Association so important?
Well, I think from listening to Sheree, you can tell the wonderful depth and breadth of the work that the American Heart Association does. I really am drawn to the fact that they provide funding that drives research that helps us that are actually out there providing medical care to our communities, that really helps us to understand better what things work. I also really appreciate their partnership with community medical providers, whether it's entities like mine that are geared towards serving underserved populations, or the broader medical community. But most of all, I really appreciate their lens of having an understanding of the importance of addressing the factors that influence health and not being locked in a box about their approach to bringing change to communities. The fact that they're willing to be open to hearing from the community as relates to health disparities and those situations and circumstances that influence health outside of just your own control, and trying to be a voice of change in terms of environmental factors like healthy environments and housing, as well as giving people education about how they can be empowered to make changes in their own health. All of those reasons draw me to the American Heart Association, but it's the heart. I mean, we're talking about the literal heart, but it's the figurative heart that they bring to the work that they do. Their willingness to be open and hear from their community, from the stakeholders that are involved, and to be influenced and to be educated themselves so that they can be more effective as they try to make change.
Okay, Dr. Lewis, you talked about having a heart for it. So if you could be remembered for having one major impact with the American Heart Association and the African American community, what would it be?
Without question, it would be eliminating the differences in health outcomes between African American communities and other major communities. I am passionate, and I know that Sheree and the American Heart Association are passionate about doing everything we can to ensure that African Americans have as great a chance for a positive health outcome, whether they have predisposition to diabetes or family history of hypertension. If we can improve our chances of survival and make sure that someone who is born in Clewiston, Florida, or Belgrade, Florida, or Riviera Beach has the same chance at a happy and healthy life as someone who's born on Palm Beach, then I'll feel like my life has that's been the fulfillment of my life's purpose.
Thank you. So Sheree, with the passion that you have for the American Heart Association, tell our community how those that are uninsured or live in undeserved areas can access the resources available with the American Heart Association.
Sure. You know, our organization is so big, and I always have to stress this, that science is the force behind all of the things that we do, right? And, you know, this year alone, the Heart Association is funding $56 million worth of research. And some of that funding is coming right here to Palm Beach County. We have funding down in Broward as well. Miami. And the funding for the research is actually what has over the years advanced medicine, right? So if you have ever given somebody CPR, if you ever learned CPR, I know in Palm Beach County, it's one of the graduation requirements. We developed the CPR protocols, right? When it comes to the pacemaker, when it comes to all of these different things that impact people's lives, literally, if anyone has ever had a stroke, if anyone has ever had high blood pressure, if you've ever had to take statins for high cholesterol, all of these different things, then you've been impacted by the Heart Association. And a lot of people don't know that. The sad thing is, though, that, you know, when it comes to the funding for the research, there were over 300 million, I believe, dollars in research that we couldn't fund this year, right? So all of those proposals. When you think about all the things that have been done, think about all the things that could be done if we were able to fund that, those other proposals. And so when I say that, like, you know, when you ask about how people can have access to the Heart Association, you have access to the Heart Association and the resources by default. But if you are looking for a specific information, one thing that you need to know is that we partner really closely with many of the health centers around our area. So Florida Community Health Centers and all of the other federally qualified health centers in our area, we do partner with to really see how we can improve the health of the community, whether it is working together to do self-monitoring of blood pressure and providing devices, or it's the resources that we have through our quality improvement initiatives that are patient education resources. A lot of times when you go to these health centers, you're getting information that was developed by the Heart Association and informed by our science. So that is definitely one way that you can get that information, by going and seeing a provider. You know, we definitely want to make sure that people understand that a lot of times you don't understand what's going on internally, and you may feel fine, you may think everything is fine, but unless you really go and get that medical, your annual visit, get all of those different tests that are done, you don't really know what's going on internally. So one thing that I would tell people is to definitely make sure that you're going to your provider, you're getting those medical visits. My doctor used to call me Dr. Anderson in another life before I got married, because I used to come in there after going on Google and tell him what's wrong with me. But at least I went, right? So the moral of the story is that if you really want to be impacted by the work, make sure that you're going and going to the doctors, because we're working with them to implement those best practices on care that's informed by the science, right? Another thing that you can do, like I said, is go on the website. There's plenty of information there for people to get those resources. But if you are uninsured or underinsured, our federally qualified health centers system and free clinics are probably your best bet. Dr. Lewis, is there anything that you want to add to that specifically?
Yes, I would say that I have to obviously wholeheartedly agree with you relative to the resources that are available for uninsured and underinsured individuals. And for people who aren't familiar with federally qualified health centers like Florida Community Health Centers, we're private nonprofit organizations whose mission is to serve all persons in our community, regardless of their socioeconomic status, regardless of whether they have insurance. We take everyone, all comers. If you have insurance, great. But if you don't, we actually have a sliding fee scale available, which means that you pay based on your income. And so people can see us for primary care, whether they're an adult or pediatric patient, if they need obstetricals and gynecology services, if they need behavioral health services, if they need dental services, if they need infectious disease services. We have lab on site so people don't have to leave to get their blood drawn. We have pharmacy on site so people can pick up their medications or get those medications delivered by mail. We offer enrollment services so that if they're uninsured, they can free of charge receive assistance with getting enrolled in Medicaid or Marketplace or food stamp programs. So we're really one-stop shopping for healthcare that unfortunately not enough people know about, that not enough people know that that resource is available to them. And so I'm strongly passionate about making sure that people hear the message that there is help for them and they just need to know to access it, which is, part of the problem, them knowing that they can access it.
Thank you so much, both. So, Dr. Lewis, with all the resources that you all have available, tell us what is the biggest challenge you face related to our community, the African American, right now, and how you are addressing it.
I'm torn about that question because for me it's really twofold, and they're almost tied in some ways. One I touched on just a moment ago, in that not enough people know that resources are available to them, resources that they can afford, resources and they can go for healthcare in a place where they'll be treated with respect. If they speak another language, translation services are available. They can access high quality healthcare that they can afford, not just this is, you're not worthy and you can't get anything beyond this, but again, high quality healthcare that they can afford, and getting the message out that that is in their community and they can access it. But the other one for me that these days is tying with that is dealing with hesitancy, dealing with that lack of trust that is historical in our community relative to the healthcare system. And as we see COVID, and COVID has impacts on the heart as well as other systems, we see that people are hesitant to get vaccinated because of some lack of trust around their interactions with the medical community or information that the medical community is providing to them. And so I really want people to find trusted educators. If that means that it's someone like me who may look like them or sound like them, I want them to reach out and take advantage of the knowledge that we have so that they can learn about how to save their own life and improve their own health.
Thank you. So earlier, Sheree, we talked about the Heart Walk. So tell us a little bit more about the Heart Walk and why and how we should get involved.
So the Heart Walk is one of those campaigns where, yes, of course, we want people to, build teams and help us to fundraise and do all of those things, but it is our largest event for the masses And it really is just about living the mission and getting out and walking, getting active. You know, we know that physical activity is one of the things that helps to improve heart health. And we recommend, of course, 150 minutes a week of physical activity, right? But, and you're not going to get that in one day, but it's a start. And we just want people to get up that day and walk. And, you know, a lot of people walk for themselves. We have a lot of survivors, heart disease, stroke survivors that get up and walk for themselves, and they have family that joins them. And then there are people who, like me, walk for people that they've lost to heart disease and people that they love who are dealing with heart disease right now. So it's an event where we try to just make sure that people are aware of the risks, that people are aware that heart disease is the #1 killer of people in the United States, and that people are just thinking about it, top of mind. Flooding, you're going to see so many things on social media about heart disease and stroke and the heart walk tomorrow, but it's really just our way of getting the message out there about the health aspect of it. So that's the why. And the how, you know, it's just get up and walk. So with the heart walk this year, it's a much smaller event. So usually we have the huge event downtown in West Palm Beach where, you know, you've got thousands of people that register and come out. Of course, with COVID, we had to scale that back a lot. It's going to be 2 smaller pop-up events that are going to happen in Jupiter at Carlin Park if you want a beach walk run, or at Howard Park in West Palm Beach. So those are the 2 pop-up locations. Or you can host your own little pop-up party at your wherever you'd like to. So if you're in your neighborhood and you have a couple of people who you would like to have walk with you, feel free to do that. We have a playlist that you can download, and it's like getting the whole Heart Walk experience. And you just listen to it, do your walk, and then of course share on social media why you walked, who you walked with, you know, what you're going to be doing after the walk to improve your heart health, whether it's getting more rest, getting more greens into your body, fresh fruits and vegetables, whether it's really thinking about how we internalize stress, because people don't know how much stress affects your body. You know, stress can kill you. It's true. And so whether it's something like, you know, you're just doing this to make sure that you're reducing your stress, you know, whether we're doing it for weight loss, because the more we weigh, that puts stress on our organs as well, including our heart, all of those different things. So it's not just about the walk, it's about the message of what you're going to do after that to improve your health and improve the health of the loved ones in your life as well. So either show up at one of the locations. I'll be at Carlin Park on the beach. Join me there, 8 o'clock. Or you can go to Howard Park if you want. Howard Park is the one that is wheelchair accessible. Carlin Park, of course, has the steps going to the beach, so it's not necessarily as wheelchair friendly. But I'll be at Carlin if you want to come hang with me.
So that our Facebook family can join you on the walk, can you tell us when the walk is?
Oh, tomorrow. The walk is tomorrow, everyone. Tomorrow morning, 8 o'clock. We will be walking. You can show up anytime between 8 and 10. Really, it's going to be from 8 to 10. It's not going to be like the traditional walk where we have, you know, the start. Everyone starts at the same time. We want people to come and walk as they see fit. You know, whether you are vaccinated or not, please make sure if you're not feeling well, do not come out. And also, if you do come, masks are very much encouraged, whether you're vaccinated or not. It is an outdoor event, so, you know, really just be responsible and think about everyone around you. So masks are very much encouraged.
Thank you. Dr. Lewis, can you tell us where you're located so that we can take advantage of those resources?
Certainly. I would say the easiest way to find us is to go to www.fchcinc.org, or you can Google us at you can Google Florida Community Health Centers. We're located in the 6-county area surrounding Lake Okeechobee. We have sites in Clewiston, Moore Haven, Okeechobee, Fort Pierce, Port St. Lucie, Stewart, Indiantown, Pahokee, West Palm Beach, and one coming soon to Riviera Beach. So there should be one close to you. And if not, we also provide telehealth services. So you can even access us from the comfort of your own home or your car.
Did we get some hot off the press information just now?
We got it.
Yes,
We got it.
Wow.
So ladies, I want to tell the both of you, thank you for joining us on our Health Spot tonight, and to our Facebook family and friends. Please join American Heart Association on tomorrow morning at Carlin Park or Howard Park to take part in the Heart Walk. Now I'm going to turn it back over to my co-host, Charlotte.
Well, ladies, again, I am so excited. I think we met our objective tonight. Thank you, Sheree. Thank you, Dr. Lewis. I think we provided lots of education to our community. We talked about the health issues that impact us in the African-American community, but now we also know where we can go and receive health services for our underserved communities, as well as our uninsured persons in those communities. So again, on behalf of the National Coalition of 100 Black Women, I'd like to say thank you, and I'd like to invite the community back on the second Wednesday of each month. We will bring health concerns to you via Zoom, and we'll be bringing resources and people who can talk about what's available in Palm Beach County for you or any of your loved ones. So again, we'd like to sign off. I think this was our first successful episode. Again, thank you all for being our first guest on the Community Health Education Talk Zoom. Thank you and have a great evening. Bye-bye.